Okay, hello everyone, and welcome to our Patient and Family Partnership Hub community conversation. This is our last meeting of the year of 2023. So welcome everyone, and thank you for joining us. Go ahead and click ahead. Now, just to let everyone know, we are recording. We do record these sessions. They are available. Usually I will send a follow-up email and you can rewatch, or if you weren't able to make it, you can go ahead and watch the recording at your earliest convenience. Now, I do see, give me one second. Let's see. I'm going to check on the interpretation. And it seems that some of you don't have it available, which is interesting because I have it up. Lindsay, if you wouldn't mind, if you have that setting available to check it out for me. It looks like Lucy is on, and she was able to go ahead and switch. Looks like I am able to as well.
Yeah, I can see it also.
Okay. If for any reason you can't, we will go ahead and try to figure this one out. Again, I was just speaking with Lucy about this, and we were sharing how this is a new change, and Zoom kind of does these changes, and we kind of figure it out as we go. So we will all figure it out. Another thing we have available is the live transcripts. And again, if you don't see the globe, if it pops up for you, sometimes I think if you're on the phone, it might be a little bit different, the settings, or if you're on your computer. But it should look just like this. Language interpretation is available. Click here to get started. So it should show you something like this. If it doesn't, then it might be a different setting, and we'll try to figure it out and navigate through that. Because again, it is sort of, even though we do this often, sometimes there's new settings, and we just kind of find out sometimes as we go.
Lucero, I can hear you perfect, and I can see this is the translate interpreter. Just letting you know, all systems go on the Spanish side.
Thank you so much, Lucy.
You
Appreciate
bet. You bet.
Thank you. And while we're talking about Zoom features, we have a few that we usually go over during our meetings. If you want to send the chat, you can either send one privately to myself, or you can share it with the whole group. Again, we have the live transcripts available if you click down at the bottom. Also, the reactions are really great to use. You can raise your hand, you can show an emotion, you can cheers for someone. So that's really great to use if you need to. We are a small group, so feel free to unmute yourself and share. And once again, this is the way the interpretation button should look. Again, if you don't have it, or if it's not available for you, but you are okay with the sound right now, that's great. But if there's any issues, please let us know. Thank you, everyone. So welcome everyone. We are going to do our introductions, and today our meeting will focus on a 2023 recap. The year is almost over. I can't believe I'm saying that, but we will recap 2023. And then definitely talk about what we're looking forward to in the future. So it's a little bit of a different meeting for us today, but it's good to reflect. It's good to see all the work that the Hub has been involved in, and lots to look forward to in the future. And right now I'm going to pass it over to Mike.
Thank you, Lucero. Good morning, everyone. Welcome to our Patient and Family Partnership Hub conversation. Again, thank you so much for taking the time of your day and joining us this morning. Please know that we appreciate you and value your time tremendously, and that you are helping shape the healthcare services for all our LA County community. Welcome again, everyone. Bienvenidos a todos. In a minute, we'll do introductions. In addition to our PFCC partners, joining us today is Lucy, who will be helping us today by simultaneously translating our conversation in Spanish, and vice versa, helping our Spanish-speaking patient family advisors join in our conversation. My name is Miguel Renteria. I go by Mike, and I'm part of the DHS organizational development team. My work evolves on patient experience and supporting our culture of patient-family engagement throughout our health system. What you see here is an overview of our vision, mission, values, and goals. Our mission is to advance the health of our patients and our community by providing extraordinary care. Our goals range from transforming our system to provide cost-effective care of the whole patient across the continuum, optimize clinical quality and patient experience, to have a high-performing workforce, and ensure financial viability in support of our vision. Today, we're moving towards our mission by advancing on our strategic goal of providing high-quality care and patient experience through engaging your voice to help us in our work. Your voice, your views, and insights are incredibly important to our work, so thank you again for taking time off your day and joining us here this morning. I'll pass it back over to Lisa. Thank you.
Thank you so much, Mike. And I will share a little bit about PFCC Partners. Our mission is to center the inclusive human experience of health, reinvent through radical collaboration, be a catalyst for system transformation. Our vision, a healthcare system transformed, one that works with people and through communities as a partner in their well-being. And our values include equity, inclusion, diversity, collaboration, and being solution-focused. Now we're going to go ahead and do a little bit of our usual introductions. I'm gonna go around and then just ask for your name, where you're calling from, and what is one thing you are looking forward to in 2024. So I will go ahead and get started. My name is Lucero Cuevas. I am calling in from the PFCC Partners office here in Long Beach. And one thing that I am looking forward to in 2024 is adventure. I don't know if I believe I've shared with the hub, I have a 1-year-old and an 8-year-old, and that age gap really kind of stopped us a little bit from last year doing much as a family because we had a little tiny baby and we were nervous about taking him out and doing all kinds of things. But now that he is older, he seems like he's ready and we are excited to get out there. I'm a little bit more confident. I would tell, everyone here that, I can't take both of them to the grocery store when he was like 6 months old. And, that would make me a little bit nervous to just be out and about with both of them. But now that he's a year old, I am excited. I am ready. And we are ready to go for 2024. We have some things planned, small things like different hikes and different adventures, things like that. So I am excited for that. And I will go ahead and pass it on to Mike.
Thank you, Lucero. Oh, awesome. 2024, 2 kids. Awesome. This is going to be awesome for you. So happy for you.
Thank you.
Everyone, my name is Miguel Renteria. I go by Mike. Today I'm calling in from Van Nuys. And what I'm looking forward to in 2024 is, I think, just being more present. I know sometimes I'm thinking like 6 weeks in advance, and before you know it, it's already 12 weeks in advance, and time just moves on too fast. So I think the goal in 2024 is just take it day by day and just be present. I will pass it over to Lindsay.
Thanks, Mike, and hi, everybody. I'm Lindsay Galley. I'm actually calling in from Sacramento, California. I'm the Vice President of Programs at PFCC Partners, and I just always love a fresh start. And I feel like that's what a new year brings, is just a time to reflect on the past year, what worked, what didn't, and just implement some new and better habits in the new year. So that's what I'm looking forward to, just a fresh start.
That's great. Thank you, Lindsay. And I will pass it on to Ronald, if you unmute yourself and share a little bit with us.
Yes, just looking forward for 2024 to achieve, all the plans that, we have made, first of all, to take good care of our health, and all of these meetings help us to, to kind of like organize everything that is up there. We're amazed that, everywhere that we go, they have new things, and which makes it easier for us, like to take care, like to get medicine, to get our doctor's appointments, and this, makes it so easy for us to kind of plan what's ahead for us.
Yeah, thank you. Thank you so much, Ronald. And I think you mentioning that, things that make, that have made things easier for you now. That's a great way to lead us to what we're going to talk about in the next slide, which is talking about everything that we've been involved in as a hub in 2023. And I am going to go ahead and get started and get started with some of these engagement opportunities that came to the hub in 2023. One of the biggest ones, or one of the ones that that we highlight, is the LDP alumni reunion with Maria Montes. Maria Montes is one of our very own partnership hub members, and she spoke at the Department of Health Services Leadership Development alumni reunion. And this reunion gathered managers and leadership and the Department of Health Services to come together and create, this working environment that is going to help the staff members, patients, and caregivers overall. And Maria just, it was her first time speaking. She's part of the hub. She comes regularly to our meetings, and this opportunity came up for her to speak and speak with leadership. So she took this opportunity. She gave a great conversation, a great speech. I was not there that day, but I've been hearing all about it. We're very excited for her. She then has, told us what a confidence builder this has been for her. And we are just very excited to continue these kinds of opportunities for our hub members. So again, this was one of them. Mike, I don't know if there's anything you want to add to this, but this was one of the great opportunities that came to us this past year.
Yeah, thank you, Lucero. I would just add that Maria, like Lucero mentioned, was invited to speak, or invited to be a keynote speaker at our Leadership Development Program alumni reunion. And this it was a 2-day event. She joined us 2 days, and she got a chance to speak in front of several hundred of our supervisors and managers across our health system. I think Maria, what she shared was, some of the struggles in terms of access and receiving timely care, but also, praise some of the improvements that we've made in the last couple years in terms of in that area, in that field. I think what was special about that is, we were kind of putting into practice what we're doing here right now with our patient family partnership hub. Is we invited those 2 ladies that you see with Maria there in the image were her interpreters for that day's event. So we invited, for Maria to share her story in her preferred language, and the interpreters did an amazing job in making sure that that story got told to the wide audience that was there that day. So we are incredibly grateful for Maria spending the 2 days with us again this past fall, and again, looking forward to continue to explore opportunities in which we can continue to collaborate in 2024.
Thank you so much, Mike. Yeah, this is a really special opportunity, and we're glad we have this picture. We have a few more, but definitely looking forward to more in the coming year. And speaking of that, we have a few more engagement opportunities that the hub was a part of. And I think as I was thinking about developing this, how to share this information with everyone, I was thinking, we have some hub members that you join us often, some join us, every few couple of meetings. And it's just important to see all around how much the community as a whole has worked on some of these opportunities. So I'm going to go ahead and highlight these and let everyone know a little bit more about them, just because they were impactful. They were a great way for people to get involved and share their voice. And I think that's one of the most important focuses here, is that we have the opportunity to share our voice, share our stories. So the first one is the health prevention disease health promotion disease prevention. That should be the other way. The HPDP program. And this program really focused on connecting patients with hypertension services, with services available in LA County. So one of the things that we did with Myra, who was in charge of this program, is we conducted a listening session here in the hub, which really allowed our hub members to share their own experience with hypertension, their experience and within their families as well. So they shared a lot of what is working in their clinics, what is working with their healthcare right now, what is not working. And they really shared a different perspective that really gave Myra, who's in charge of the program, a different lens to looking at this program. And we also shared a survey with this after the listening session. We shared a survey, so in case our hub members were not able to attend, they can answer a quick survey, and I will share that as well. And this follow-up for this meeting, because we still have it open. Myra is still definitely open to hearing people's thoughts, suggestions, and experiences with hypertension. So I will share this and pass this along, continue this sharing information with the hub. We also had our Decipher research study, which was looking to improve high blood pressure treatment. For this one, they developed the focus groups that targeted various racial and ethnic backgrounds. So we did reach out to some of our hub members and connected them to the Decipher research study folks for their for their focus groups. So that was another opportunity to share experiences about, with hypertension, high blood pressure. Another one that we focused on is access and visit survey. So for this one, last year, yes, we're still in 2023. Last year, LA County Department of Health Services implemented a new medical practice survey. And the questions were really based on several domains, but two of them that we focused on was access and the way you move through your visit. So we brought all these questions to the hub, and we asked to hear your thoughts about these topics. So we asked our hub members, how do you schedule your appointments? And what is that process like for you? And other questions like, how are you informed about delays? And what does that look like for you? Okay, what is working, what is not working? So we got to hear a lot of input from the hub members of what their visits look like and how moving through their visits, how delays are, how are they contacted. We really got to see a lot of what the hub members are experiencing for themselves and for their family members. So that was a great way to get, again, our hub members involved and get to hear their side and what they're experiencing. And this last one is the medical refill process and improvement. So this one, Lindsay, if you can please feel free to correct me if I'm wrong. This one is still ongoing. And it is a plan to maybe have a listening session with the hub to get patient perspective on what their thoughts are on refills and renewal issues with their medication.
Yeah, you're right. You're right on there, Lucero. And this is something that we haven't introduced to the hub yet, but should be coming in the new year. We're actively getting in touch with the team who is interested in engaging patients and family caregivers through this improvement process. So more to come on that.
Thank you, Lindsay. Yes, definitely more to come on this one. But again, lots that the hub is able to, the community able to share their voice, share their experiences. And again, one of the ones that we're still definitely focusing on, and I'm going to share this information once again, it's the HPDP program. Again, that survey is open, so I will share it again with everyone. So if you have your own experiences with hypertension, or you have family members, or you are a caregiver to someone with hypertension, please feel free to fill it out. Definitely your voice and your opinion is important for all of us to hear. And more engagement opportunities that the hub participated in. Some of them include the DHS Labs queuing system feedback. And this was they brought the queuing system to the hub, and they showed us all of the implementation, everything that they worked on to implement this at different clinics around LA County. So we really got a chance to look at, what is that process for someone walking into a clinic? Like, what are they what are their options? What are they clicking on? What, how easy is it? How difficult it is? So we got a chance to show this to the hub, and the hub really shared their thoughts and opinions about it. So that was interesting to see that different side of what is being implemented in our clinics. And then also we focused on community. We had a PFA network open house. This was earlier in the year. And we really, this is one of our in-person events. So again, those stopped for a while, right? Through the pandemic, and we had one of our first in-person events after a while. And the PFA network really just invited everyone in the community in LA County to join us. This was a great opportunity for us to connect. Oh, I see the message. Definitely. So this is a great opportunity for us to connect and to meet in person for one of the first times. So that was a great event. We're hoping to have more in 2024. And the next one, or I think one of our last ones, is the Visión y Compromiso conference. So this one just took place not too long ago, I believe a few weeks ago. And this is a Visión y Compromiso conference, which focus on promotoras in the community, actually nationwide. So this was a great event which gathered all of you promotoras around the country. A lot of the focus was in California, but I attended, Mike attended. We definitely saw people from, Texas. We saw people from, I can't think of any other states that were in attendance, Mike, but there were quite a few. And this was a great opportunity to see where the promotora community is, how united the promotora community again is connecting, is how they are involved in the community. I got to be a part of one of the sessions, which was really interesting for me to see. I brought all of the information back. So this was one of those that we wish to connect with the promotora community, and we are looking forward to advancing this in 2024, definitely. Is there anyone here? I have Maria. Maria, are you connected? I know that you just joined us, but if you click on either English or Spanish, you're able to hear us. Please, if you can let us know if you're good with the sound.
María, ¿está usted en la línea de español o en la línea de inglés? Maria, are you in the English line or the Spanish line? It's possible that she doesn't know how to open her microphone, Lucero.
Okay.
What does it start? What does she have to do to open? Just push the microphone, right? Click
Yeah,
it.
just a little globe, yeah, in the bottom.
Okay. Señora María, acuérdese que nada más tiene que hacer oprimir el globo que está abajo y ahí va a escoger Spanish y me va a escuchar a mí. Bueno, okay, Lucero, thank you.
Thank you. Thank you, Maria. And thank you, Lucy, for helping us with that. So back to this one. So yes, our the Visión y Compromiso conference was really a great way for myself, and I know Mike attended as well, to really see where the community is. I got to speak to a few promotoras in my table, and it was a really great experience. I was sharing with our staff that the promotoras that I sat with were really just starting out with their community. So they were new college grads that, really they shared the impact that the promotoras had with them growing up and how they are looking to continue that work. So it was really important for me to see. It was really great for me to see what their work is now, especially them just being fresh out of college. It was a great opportunity for me to learn from them and continue to learn as we move on to 2024. Mike, I know you attended. Is there anything you want to share about this conference? I know it was a great one.
Yes, thank you, Lucero, so much for kind of, taking us back this past year and all of this great work that our patient family partnership has been a part of. In terms of the Visión y Compromiso conference, it was a great experience. I think there, Maria Montes invited us to attend this conference after she was a keynote speaker. She shared with us on or she has ideas about how we could greater collaborate with the promotora community here in LA County. So we got invited to attend the conference, and we attended. And just like Lucero, I was very glad or happy to see such a great community. I was expecting a small conference, but this was, there was a few hundred people there on day one, and I could only imagine, probably in the peak of the conference, probably more. But it's a great community that consisted of folks not only from California, but from Washington, D.C., from Texas. I think I heard from Mississippi, Northern California, some different areas. So, I think the goal there is to really just, continue to explore what the community looks like, and really seeing how we could collaborate with our patient family partnership hub, our patient family advisory community throughout the health system. So definitely a great experience attending the Visión en Compromiso conference.
Yes, thank you, Mike. And I also heard from Maria after. I asked her, Maria, I didn't see you. She said, I was there Friday, Saturday. So we would have completely missed her. The conference was 3 days. So I think Mike and I attended Thursday. And then Maria, which is, one of our hub members, attended the other 2 days. So we didn't cross paths, but again, she was definitely had a lot of great things to share about this conference as well. So it was really great to just connect in that way with her. And if they have one next year, we will definitely pass that information to our hub members here as well, if that's something that they are interested in. And now that we have reflected on some of the engagement opportunities, some of the work that the hub has taken a part of, I want to take a minute to look forward. So here on my next slide, I just have 2 questions to ask everyone. And one of them is, what are you most proud of this year? And I'll go ahead and start. I would say for me, it is being the facilitator here. I started, I believe, about mid-year, even though I had been, kind of on the background, helping Laura with, developing certain aspects of our meeting. And this is, again, something that I find a lot of interest in. I love connecting with folks, and I am just so glad that I have been here for quite a few months, and I've gotten to know a few of you. If it's not through, Zoom, it's through email, it's through phone calls. So that has been the absolute thing that I'm most proud of in regards to the partnership hub. And personally, I would say just growth in general. Growth as a parent, managing and navigating through, new life with 2 little ones, and then also, here with everyone. So that for me has been amazing. And if anyone else would like to share, I won't, pick on anyone, but if there's anyone that wants to share a little bit of what they're proud of and what they're looking forward to, please feel free to share.
Can I say something, Lucero?
Absolutely.
Just run on, sorry.
Thank you. Yes.
Yes, I'm very, very, very happy for the whole year, or the way from the how can I say this, from the beginning to the end, how you make this very happy how you make these meetings, how you first send the invite at the beginning, and how you finish saying thank you at the end. All of these meetings, it's a big, big, big. It's like finding treasure, in all of our needing, to know where to go, to know what to do in the places that we go to, in the hospital. So I want to thank you for,
Thank you.
For the work that you do.
Thank you, Ronald. I think that you said a lot that really is really gonna stick with us, definitely 100%. Our hope and our effort here is to just make everyone feel welcome. And really everyone is welcome. And one of the things we want to express as well, not only one day, which is, our end of the year meeting, but throughout the whole year, is gratitude and how grateful we are for each and every one of you that joins us whenever you all are able to join us. We 100% understand schedules and so many things happen and are going on. But when you are able to join us, it's great to see you. It's great to hear all of you. It's great to see a response in an email or a chat or a phone call, any which way in which this hub community participates. For us, we are just so very grateful. So thank you, Ronald, so much for those kind words. And is there anything you're looking forward to next year, Ronald, that when it comes to, the hub? I know I asked a little bit of, during our intro, but is there something you want to highlight next year that you want to see?
Yeah, I already have, I'm like I said, I'm just waiting to see, what's gonna happen on 2024. I know good things are coming our way, but the way the system is working now, that some of the doctors or nurses are calling us to prepare us for the next meeting, the next doctor visit for next year. So that's what we're looking forward, and just knowing, that all this information is right here, it gives us, it gives us more like a strength to continue, to continue forward, because now we know where we're going. We don't need to be going from left to right. It's all in one place, Everything is all in one place, the things that you guys give info to everybody who's willing to learn and to listen.
Thank you
Yes.
so much, Ronald. That definitely is a lot to look forward to next year, and we really appreciate you. And I will leave it open to anyone else if they want to share anything that they are most proud of this year. It's good to end on a good positive note. There's you think about 12 months and it's it goes by really quickly, and we tend to focus on sometimes on the things that didn't work, or some things that didn't go perfectly planned, but there's so much that was good.
Lucero, I can go next. This is Mike, everyone. I think this past year, we've been really working in terms with our leadership in establishing a stipend for our patient family advisor community to attend, these conversations, to attend listening sessions, focus sessions. And, we're happy to share that, over the summer, our Board of Supervisors approved some resources to begin doing that. We are now finalizing the policy and procedure for this resource, and I'm very anxiously awaiting to be able to report very early next year that this resource is now available and available again for the folks that participate in these conversations. Again, we value your time. You help us do better, and we want to be able to provide a stipend to help with any resources that you may be needing or whatnot. I think we come from the lens that volunteering is a privilege that not everyone can afford. So we want to continue to, in 2024, to continue to invite others and everyone to the table to tell us again what we're not doing good, and at the same token what we could do better. So that is something that we are looking that we're, for one, proud of this year of establishing it. As everyone knows, this is a county government, so there's a lot of different layers to go through in approving a resource like this. But we hope moving forward that this is going to help our community and continue to grow and expand for the years to come.
Thank you so much, Mike. We are definitely looking forward to 2024 for some great news in regards to that. And I just want to share a little bit of what Maria shared on the chat. She's having a little bit of connection issues, so I'm going to just go ahead and translate what she says. She says that she feels grateful that she is learning with us. So thank you, and thank you, Maria, for joining us. Again, we're just we are grateful that everyone's here, and that you all get our messages, you'll get our invitations, you'll get our information that we sent out there. So again, thank you all so very much. And if there's anyone that wants to share, I think that only leaves you, Lindsay.
Yeah, I was like, I'll jump in. I'll focus on looking forward into 2024. I think one of the things that I was proud to see this year and look forward to seeing more of in this coming year is just more opportunities for each of you to share your voice, your experience, and your perspectives of, you know, how you have experienced healthcare in Los Angeles County, and really being able to utilize those perspectives, your own individual and unique perspectives, to inform continued improvement at LA County Department of Health Services. So I'm really proud of, you know, all of the staff members and teams who have come to us, you know, looking for the patient and family caregiver voice. And yeah, just looking forward to continued growth of those new opportunities. One of the things that we heard recently in a meeting that, you know, will continue to move forward is moving from story to strategy. So you each have a story to share. So for
I
us,
gotta close my goddamn window.
it's it's what we can do with that story to create strategies and, you know, new projects that all lead to improved outcomes for all patients and family caregivers in Los Angeles County. So I'm just looking forward to continued growth and continued opportunities for all of you.
Thank you so much, Lindsay. Thank you. And Michelle, I see you. Thank you for joining us. We are wrapping up what we had a little recap of 2023, and right now we're just focusing on what are we proud of this year and what we want to see in the hub next year. Yeah, I know I'm filling you in. If you definitely are not ready to share, that is a-okay, but I wanted to fill you in before we move on. But it's open for you if you'd like to unmute yourself, but if there's, obviously you just signed in, so no pressure.
From what I can remember, it's empowering to, you know, it's, I don't know a better word for educational, but it's empowering and it's educational. So like I know more than I did know before I found out about the network. And I think that's it. That's all I can get off the top of my head.
That's amazing. Learning. We are all learning. We are all learning. And just like you said, you are learning, so are we. So we're excited to continue that in 2024. So thank you, actually, Michelle, for giving us that thought. I had not thought of that before, which is, you know, we are learning. We are, you know, we're providing information, and just as you all are learning, so are we, and we continue to do that in next year as well. But with that being said, we are going to meet next year. We're going to hit the ground running. January 16th, we are having our first meeting of 2024. So we are very excited. Again, I will continue sending my communication, my reminders, and all of that. So please feel free to reach out. Please, you know, if you have a question, call us, call me here in the office. I'm here in the Long Beach office. You can send me an email. You know, please, it's open for everyone. We want to make sure that that, you know, if you have any questions, you know who you're going to speak to, which is myself, you know, Lindsay's also available, and also Mike as well. So again, thank you everyone. And we will see everyone in January. But other than that, we want to wish you everyone a happy holidays. The year is almost ending. I can't believe that. We wish you all the very, very best. And we hope to see everyone in January. Can't believe I'm saying that, January 2024. Have a great year, everyone, and happy holidays. Thank you so much, everyone.
Thank you. Take care, everybody.
Take care.
Thank you.